And good evening, everyone. Cases of COVID-19 still climbing. So much so, it's caused Metro Nashville to revert back to phase 2 of reopening.
The numbers show how it's affecting the volunteer state. Let's take a look. With today's report of 1,575 additional cases, this is easily the worst week of the pandemic when it comes to new cases. While it's true that more people are getting tested, the percentage of people testing positive hasn't had much of a change and is actually slightly higher. Now, the uptick in coronavirus cases is now beginning to be felt in the state's hospitals. Just in the last month, the number of people hospitalized with COVID-19 has more than doubled.
And now, one Middle Tennessee hospital is actually having to divert patients here to Nashville. News Channel 5 Chief Investigative Reporter Phil Williams is keeping a close watch on the numbers that could affect you and your family. Phil.
Well, guys, experts knew that with the rise in cases, it was just a matter of time before hospitalizations began to increase. In fact, more people are in the hospital today in Tennessee with COVID-19 than at any other point in the pandemic, and those numbers are rapidly growing.
I think this is probably the most dangerous moment we've had in COVID-19, and that's because there are more cases in the community than we've had at any point. And there's more disregard for the virus than there has been at any point.
Dr. Matt King has been on the front lines in the battle against COVID-19, first treating patients at Sumner Regional who were evacuated from a Gallatin nursing home, then spending a few days in New York helping out there, even contracting the virus himself. A month ago, King says Sumner Regional was down to one COVID patient.
I mean, really, in the last week, we've seen a huge change, and now that we're having 3 or 4 hospitalizations a day sometimes, and our hospital has been at capacity, so we're having to transfer people into Nashville for care, which is not something that we've had to do at any point until last weekend.
Take a look at these stats. Back on April 1st, there were 117 people hospitalized statewide with confirmed cases of COVID-19. Between May 1st and June 1st, the numbers hovered right around 300. Then that number more than doubled to 632 by July 1st, and there were another 323 suspected cases awaiting test results.
I mean, my greatest fear is that this increase is going to continue, and hospitals are going to reach capacity, and we're going to have a big problem at that point.
That's exactly what is happening right now in Texas, and Florida hospitals are also feeling the strain. Among the indicators being watched here in Tennessee, the number of active COVID-19 cases more than doubled between April 1st and May 1st. It almost leveled off for the next month, but shot up dramatically again throughout June. As of today, more than 17,000 Tennesseans are considered to be in the active stages of the disease.
And now we're just seeing them from all throughout the community. There's no real pattern to it. It's people who got it from family members who brought it home from work. It's people who got it at church retreats. It's people that got it at family reunions, and people that have no idea where they got it.
And the more the virus spreads, the more people who are put at risk. King says one patient stands out in his mind.
It's a really sad case. She had not left the house since March because she was trying to protect herself, but had a family member that needed to go to work and unfortunately contracted the illness and brought it home, and she didn't survive it.
Suited up, 6:30 in the morning, getting ready for my first shift up here in New York.
As to the comparison to what King saw in New York,
we hear from a lot of people saying, don't compare us to New York. We're not New York. What is your answer to that?
My answer is that we're not New York now, but we could be. And that's what's terrifying.
Now, according to the state's tracking, about 20% of the staffed hospital beds in Tennessee right now are still available, as well as 20% of the ICU beds, although that's suddenly down from about 25% in the last few days. Still, the Tennessee Hospital Association says overall the hospitals are in reasonably good shape for now. In fact, they insist that patients should not let these COVID concerns keep them from addressing their other medical needs, because postponing those kinds of treatments can also have serious consequences.